See,
You almost called me Erin Mycology.
Well, there's a reason for that. Dr. Cherie Ann Nathan is joining us. Hey, Doc, how are you this morning?
Good, thank you. Thanks for having me.
My pleasure. Okay, so the question was that I kind of messed up with Erin's name because we've only been working together 20 years. What the heck?
Yeah.
Is it otolaryngology, otolaryngology, and what is that exactly?
So, otolaryngology is really ENT, ear, nose, and throat, but it's the most sophisticated name. Oto is ears, and laryngology is of the voice, the larynx. The even longer name is otorhinolaryngology.
Oh,
so
Lord.
ears,
Well, let me
rhino,
write
nose,
that
throat.
down right now.
You wrote way too many term papers for my sake. This is Oral Head and Neck Cancer Awareness Week, correct?
That's correct.
How important is it that we talk about this? We don't talk about it much, do we?
No, we don't, and I'm really glad we're doing this. And the Head and Neck Cancer Alliance has spearheaded a national week all over the country, and actually it's really taken off internationally with 400 other countries participating this week. But I think it's very important because in a recent study that they did, where they surveyed about 500 adults between the ages of 18 and 75 about their knowledge of head and neck cancer. And surprisingly, 67% of people did not know what head and neck cancer was.
Pardon me, Doc.
So
I was just going to say, what is head cancer?
So head and neck is really diseases of the throat, the oral cavity, which includes the tongue, the lips, the lining of the cheeks, the voice box, sinuses. So these are tumors that arise in the mucosal lining of these areas. And it also includes thyroid cancer, which is also one of the fastest growing malignancies in the United States.
What are some of the early warning signs?
Many of the signs for head and neck cancer are what you see with common diseases, like, a sore throat, and you think it's just a tonsillitis. But any persistent sore throat past 3 weeks should be taken seriously because many of these tumors sit at the back of the tongue or on the tonsil where they are hidden, and you really don't diagnose them till they've spread to lymph nodes in the neck. An ulcer in the mouth that's not healing, a red or white plaque in the mouth that seems to be getting worse, hoarseness, again, common complaint for people who have laryngitis. But if your hoarseness persists past 3 to 6 weeks, that really requires a referral to an ENT so they can scope you and look in the voice box for any hidden tumors.
Pardon me just a second. You just scared the hell out of everybody listening to this radio station this morning because it's allergy season, and I would be willing to bet that about 75% of listeners have had a scratchy throat for 2 or 3 weeks. Is there a way to tell the difference, or should all those people rush in and be checked?
No, definitely not. Allergies only causes a scratchy, itchy throat and can cause hoarseness, but the hoarseness comes and goes. It's intermittent and it's related to the runny nose and allergy symptoms. Persistent hoarseness that is progressively getting worse. You wake up with it in the morning, you're hoarse at night. That's concerning, and especially if you're a smoker. So most of these head and neck cancers are associated with tobacco use, smoking, and chewing tobacco for oral tongue cancers. The combination of smoking with alcohol is synergistic and increases your risk 100-fold. Now, I do want to mention that this disease, head and neck cancer, was a disease of the older population in their 60s who had smoked and not really taken care of themselves. But there's an epidemic now of head and neck cancers, especially of the throat, that's the back of the tongue and tonsil, that's occurring in the young people, especially in young men in their 40s and 50s who've never smoked, who are healthy.
What's causing that? What's causing it?
So this is a result of the HPV virus, type 16. The same virus that causes cervical cancer in women is now really an epidemic in Caucasian men in their 40s and 50s, and is supposed to overtake cervical cancer by 2020.
Wow.
Head and neck cancer.
Is this cancer treatable?
Wait. Ask her the question.
What?
About how that happened.
How are men getting this?
Maura Gillison from Hopkins, who's now moving to MD Anderson, has done some really elegant epidemiology studies and shows that it's related to oral sex, and the number of partners you have, the earlier you start it.
So pardon me, this is that Michael Douglas thing from a bunch of years ago. Actor Michael Douglas said, "I've got throat cancer, and it came from too much oral sex." That's what he said. So he wasn't crazy.
That is true. It's associated with oral sex, but, that doesn't mean, obviously, that everybody who's HPV infected gets cancer. It occurs in less than 1% of HPV infected patients, and that's because your body clears this virus. So it's only persistent infections that cause these cancers, and in a very small percent of the population, because there's other factors that probably go into play that we don't know.
But you use the word epidemic, which is scary.
It is, and I think it's important for people to know that this is a preventable cancer because of the HPV vaccine that's out there, and it's now approved for boys for the ages between the ages of 11 and 21. So it's not just for girls, but for boys as well. And I think there's a big move on the part of the American Association for Cancer Research, ASCO, American Head and Neck Society, the CDC, to promote this vaccination for boys.